Low-skilled immigrant labor costs the taxpayers today $19,000. Each of us pay $19,000.
You know, Mark, if you think we have a problem with illegal immigration now, wait till you see the borders when this thing gets passed.
They put a strain on our Social Security, our education, our health care.
And then these people cross the fence, and all of a sudden they're victims. They deserve pity, and we hard-working Americans who are here legally should bow to them.
Saying health should be a right is just an inaccurate thing to say. What you're actually saying is that health care should be a right. And no, it should not be, and it isn't.
There are different ethical viewpoints regarding our responsibility towards undocumented immigrants. The nationalist view is that a person who is here illegally has no ethical claim on healthcare services. However, this raises the question of whether or not healthcare is a right. According to several international treaties that the U.S. has signed, including the International Declaration of Human Rights, everyone has a right to health. The U.S. is ethically bound to uphold these treaties. There is also the issue of professional ethics. Healthcare professionals are ethically obligated not to withhold treatment to those who seek it. No matter what the public policies are, healthcare workers must uphold this ideal. There is also the argument that, as a society and a community, we have a social responsibility to care for the disadvantaged among us, even if they don't have the right paperwork.
There are also those who claim that our reform efforts would ensure illegal immigrants. This, too, is false. The reforms I'm proposing would not apply to those who are here illegally.
Medicare is a federal program that provides health insurance to U.S. citizens aged 65 and over. With the recent health care reform legislation, Medicaid will provide health insurance to any U.S. citizen under 133% of the federal poverty line, approximately $30,000 for a family of 4. State Children's Health Insurance Program is a federal and state program that provides health insurance to poor children who are either U.S. citizens or legal immigrants. The only exception for undocumented immigrants is that some states allow Medicaid and S-CHIP to fund prenatal care for undocumented women who give birth to U.S. citizens. In 2014, a health insurance exchange will be created to allow citizens access to streamlined and often discounted private health insurance. Undocumented immigrants will be prohibited from accessing these exchanges. Emergency Medical Treatment and Active Labor Act requires emergency departments to treat patients without discrimination based on citizenship status or ability to pay. Emergency care could be anything from a bandage to a 6-hour emergency surgery. Community health centers provide services at low upfront costs to disadvantaged populations. There is no law that requires community health centers to provide care to undocumented immigrants, but most still do. They served 17.1 million patients in 2008. In 2012, they will receive an $11 billion funding boost. Is this the most effective way to provide care for the people living in the United States? The U.S. prevents undocumented immigrants from access to most primary care and allows them only access to emergency care.
The 12 million or so undocumented workers are here who are not paying taxes in the ways that we'd like them to be paying taxes.
All of the open borders advocates, all of the unconditional amnesty advocates say that illegal immigrants are already paying taxes.
You know it's crap.
You know that annoying 5% tax that you have to pay almost every time you buy something? Undocumented immigrants have to pay it too. In addition, undocumented immigrants pay property taxes just like everyone else. For people who rent their house, property taxes become part of their rental payments. Moreover, it is estimated that 50 to 60% of undocumented immigrants pay income tax, Social Security, and Medicare, which is especially striking since undocumented immigrants cannot access many of the services that are funded by these taxes. When asked why they pay these taxes even if they do not always have to, some undocumented immigrants responded that they just feel like it is the right thing to do. But many people wonder how all of these taxes actually add up. Well, undocumented immigrants contribute an estimated $7 billion annually. This estimate is based on the amount of taxes paid by W-2 forms that have inaccurate or mismatched data, a category which would include undocumented immigrants. Great.
I know that it's a complicated social issue and political issue, but from a healthcare perspective, there's no doubt that they should have been covered.
Do you see undocumented immigrants who are indeed buying insurance, if that's even possible?
There are some. They are uninsured at a much higher rate than the general population.
Much of California's crisis stems from billions in unpaid medical bills. Many bills left unpaid by illegal aliens.
It is even more difficult to find accurate numbers on the cost of undocumented immigrants. The cost of all uncompensated health care in the U.S. is roughly $58 billion. It is very difficult to determine how much of these costs are from undocumented immigrants, since hospitals cannot inquire whether a patient is a legal citizen. A RAND study found that the estimated cost of care for undocumented immigrants aged 18 to 64 was $1.1 billion in 2000, which is the equivalent of roughly $11 per taxpayer. However, the Federation for American Immigration Reform estimated the cost of uncompensated health care for undocumented immigrants in California alone to be $1.4 billion in 2000. As you can see, these estimates are very different. The lack of any sort of consensus about the costs and benefits of undocumented immigrants detracts attention away from other important issues, including undocumented immigrants' lack of access to health care.
A case study of healthcare access in California shows an example of the barriers that undocumented immigrants experience. In 2007, Governor Schwarzenegger proposed a universal healthcare bill that would include undocumented immigrants. However, when the financial crisis hit, the state was forced to cut budgets, and now undocumented immigrants cannot access care in county clinics. They must rely on community clinics that provide discounted care and do not have access to specialist services. Some have criticized that this is just shifting the cost to emergency departments. California has the largest population of undocumented immigrants in the United States. Denying them access to health care will not solve this issue, but only harm their own population. You may be asking yourself why any of this matters. Because if we don't have compassionate and sensible policies, everybody loses. Undocumented immigrants cannot access health care, and so they are pushed further to the margins of society. Healthcare professionals are forced into positions where they may have to violate their ethical responsibilities because of misguided policies. The American public is put at greater risk for communicable diseases. Improving the health of one community will improve the health of the public as a whole. Americans pride themselves on ensuring liberty and justice for all, but this reputation is compromised when we refuse basic medical care to some of the most vulnerable among us.
Upcoming immigration legislation should recognize America's duty to provide basic care to everyone. Informed policy decisions are impossible without objective data. More funding should be allotted to community health centers and other resources that provide comprehensive medical care to undocumented immigrants.
Now, you may be thinking, well, yes, I agree. Undocumented immigrants should have access to health care, but what can I do to help? Most importantly, you can learn about the issues regarding undocumented immigrants' access to health care. You can then share your knowledge about these issues with others. You can also support community centers that provide health care to undocumented immigrants. Finally, you can use your voice by communicating your opinion about these issues to your political representatives.
In the receipt of necessary medical care, We cannot allow a social underclass to exist in the world's richest nation.